All right, we're continuing to focus on Breast Cancer Awareness Month here on Good Day Austin, and this morning we're focusing on breast cancer treatment and nutrition, how that comes into play with Dr. Mika Cline from Texas Oncology. Thank you so much for coming in this morning.
Thank you for having me.
So this is just one more thing that patients have to think about when going through breast cancer treatments, how they deal with nutrition, because so many things can affect your taste and weight loss and weight gain. So how do you start off with patients? What kind of guidance do you give them?
Well, we try to warn them that your cancer treatments may result in an altered taste. They're going to alter your energy level. They're going to alter your appetite. And all of those are going to affect your weight during treatment. Most folks think that weight loss is a big problem during cancer therapy, especially chemotherapy. But conversely, weight gain can be a problem during some of these treatments.
Yeah, we do hear a lot about weight loss, but that's not the only issue. Like you said, weight gain. And then this is just one more thing that those patients have to worry about and be concerned about when dealing with their treatments.
Absolutely. And so what we try to tell patients, we try to give them some general guidelines, try to maintain good nutrition, get an adequate intake of protein, carbohydrates, nutrients, stay hydrated, get enough water. And if there are specific problems in your cancer treatment, we try to give them tools to deal with that. Sometimes we do suggest they might need extra help, such as talking to a registered dietitian or a nutritionist, and that may really help.
Yeah, that probably is very helpful. For some patients, are there certain foods that they're told to avoid or stay away from?
I think what cancer patients are going to find is that their taste is going to change. So if you are a coffee drinker, you may find that you can't stand the taste of coffee. You may find that you have a metallic taste in your mouth all the time, and that's really affecting your intake. So it may be something very simple, such as using plastic dinnerware, believe it or not.
Interesting.
If staying hydrated is a problem because water tastes bad, you might need to flavor your water or move to sports drinks, juices, whatever you need to do to stay hydrated. If you can't tolerate meat, protein is still very important, so look for alternative sources of proteins.
Okay, a lot of good tips out there for people. Let's talk a little bit more about energy levels, because of course that is something that we hear about, that your energy level just drops when going through treatments, especially chemotherapy. So how do you change that?
Well, we do acknowledge there's definitely going to be an impact on your energy. There's going to be days, especially right after you receive chemotherapy, you may not feel like doing much, and that's okay. But that within that, still try to stay as active as you can. Some patients feel like they just need to take it easy all the time, but if you sit or lie in bed all day, you lose lean muscle mass, and again, that affects your weight, and that in turn can affect your energy level and your overall health at the end of treatment. We want you to come through treatment as healthy as possible.
Yeah, and then of course it also is important to make sure that you are still eating, even though there are probably days where you don't feel like having anything to eat.
Absolutely. And what you may find that helps is, instead of eating the 3 meals a day that people generally eat, you may not be able to do that. So graze, maybe eat 6 times a day, very small amounts, but just concentrating on getting enough protein and getting your nutrients in.
Okay.
If you have to, sometimes it makes sense to take a multivitamin, but always talk to your doctor if you want to start supplements, because that may affect your cancer treatment.
And this is why you're here, to help these patients get through this and deal with any issues that they're having related to nutrition and their treatments.
Yes, absolutely.
Let's also talk about the recent guidelines that came out from the American Cancer Society about treatments for breast cancer.
Yes, so certainly whenever an organization makes new recommendations about when to get your mammograms, there's always an element of controversy. And so the American Cancer Society recently came out with guidelines suggesting that women start regular screening mammograms at age 45, which I thought was interesting, because some recommendations suggest starting at age 40 and some at age 50, and that seems to generate a lot of controversy. What we know is that mammogram is the single best tool to save lives from the standpoint of breast cancer, so it makes sense to use it. I think the guidelines are good in that they acknowledge, hey, there's a lot we still don't know, but this is the best information that we have.
So is that something that women should follow by the book now, these latest guidelines, or just case-by-case basis, speak with your doctor?
I think so. I think as in the future, it's all about personalized medicine. It's all about your individual risk factors, and that's going to depend on your personal history, your family history, if you have some sort of genetic risk factors. These guidelines are for women at average risk from breast cancer.
All right, good information for us this morning. Dr. Cline, thank you for